Autopsy doctors, what has been the biggest revelation you've discovered about a person's death after performing the procedure? During my time as a student assisting with postmortems, I had an experience that deeply stuck with me. The patient was a woman in her 40s who had a history of chronic abdominal pain. Over the years, multiple doctors had dismissed her complaints, some even referring to her as a hypochondriac, while others suggested her symptoms were rooted in anxiety. There was no suspicion of any serious underlying condition, just a long history of being brushed off. When we opened her abdomen, what we found was heartbreaking. Inside, she had extensive scar tissue. Her abdomen was absolutely massacred by endometriosis. It was clear she had been suffering for decades, likely in excruciating pain, but her condition had never been properly diagnosed or addressed. The fact that she had never been referred for a laparoscopy, despite her persistent symptoms, was astonishing. It became evident that she didn't have anxiety, as so many doctors had assumed. She had a serious, chronic medical condition that had been causing her immense pain all along. The realization hit hard. She had been ignored, dismissed, and misdiagnosed, and her suffering was dismissed as something psychological when it was anything but. Her cause of death was unrelated to this condition, and I can't share the details because it might be too identifying. But the injustice of what she went through, decades of untreated pain, compounded by a lack of proper diagnosis, stayed with me. It made me realize how important it is to listen to patients, take their concerns seriously, and not brush off their pain, especially when there is no clear explanation. This was a clear case of how medical conditions can be misinterpreted, with devastating consequences for the patient.